Hello and welcome to today's webinar, Qigong, Simple Exercise for All. My name is Bev Bromfield and I'll be your moderator for today's presentation. Before we start, I'd like to go over a few items so you know how to participate in today's event. We've taken a screenshot of the attendee interface. You should see a panel that looks like this on your computer desktop on the right side. You've joined this presentation using your computer's audio system by default. This means if you hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, select Use Telephone in the audio pane and the dial-in information will be displayed. Follow the instructions as provided. You'll have the opportunity to submit questions to today's presenter by typing into the questions pane on the control panel. While we also receive questions in advance of today's webinar, we'll try to address as many as possible during the Q&A with our speaker, Craig Ing. Before we start, a few words about what the National Psoriasis Foundation does. At the heart of all we do is our mission to drive efforts to cure psoriatic disease and improve the lives of those affected. We accomplish our mission by funding research with over 30 million awarded in grants and fellowships, collaborative and transformational research initiatives. The NPF also offers education for those living with psoriatic disease and encourages all to become involved with our mission. Learn more about our research, education, and how you can become involved by viewing the links listed on this slide. On behalf of the National Psoriasis Foundation, thank you for attending today's webinar, Qigong Simple Exercise for All. And I'd like to introduce you to our speaker, Craig Ing. Craig Ing is a registered kinesiotherapist who will present today's introductory sessions to Qigong. As a kinesiotherapist, Craig works with clients to develop and monitor exercise programs to help them regain muscle strength and function due to injury or disease such as those that affect the muscle, joints, and connective tissues. Craig is an accomplished therapist specializing in orthopedics and sports medicine, holding multiple credentials and certifications. Craig has trained and coached people of all ages and ability levels. Craig is also the owner of Ing Martial Arts and Advanced Training. He is a lifelong martial artist, having studied and holds ranks in multiple martial arts styles with more than 25 years of teaching experience. It's my pleasure to welcome Craig Ing.
Thank you. Disclosures, I have no financial relationships to disclose. So today, we're going to talk about Qigong. We're going to go over a few things that we will be learning today. What exactly is Qigong? What are the benefits and potential risks of practicing this form of exercise? We're going to go over some sample exercises and then have the opportunity to try those and practice those with me. And then talk about some resources for folks who are interested in practicing Qigong. So jumping right in, what is Qigong? Qigong is a traditional form of exercise that was developed in China thousands of years ago. It is a large part of traditional Chinese medicine. Take the definition a little bit further. Qigong is Chinese in definition, in the name. So to define that a little bit, help us understand a little bit more, Qi is a term used to describe energy or a natural force that is in all living things. Traditional Chinese medicine says that is the source of life in all living things. And the concept of qi predates 2400 BC and going back to traditional Chinese philosophy. The second word is gong, and that refers to work done over time requiring energy. So the term qigong, roughly translated, means training or study dealing with qi, and that process requires work, time, and energy. Now, the goal of Qigong is to improve and maintain the health and well-being using these exercises, trying to optimize that energy within the mind, body, and spirit. Ultimately, if we think of our physical body as a machine, we can view Qi as the current that helps to make that machine work. And without that current, the machine is unable to function. So Qigong exercises are intended to get the body moving using that current and keep that machine functioning. Some characteristics of Qigong, the practice of Qigong. In most forms, now there are many different types of Qigong, different exercise sets and different routines that have been practiced over the years. Many of them, the breathing is done very slowly, long, and deep. The breathing patterns can switch from abdominal breathing, which we're going to work on today a little bit, as well as breathing combined with speech sounds. Typically, the movements are done very slowly, very gently, and very smoothly, and they're intended to focus on relaxation while moving. Now, mind regulation, the cognitive aspect of it, focuses on focusing your attention as well as some visualization, and those just kind of help the process. In Qigong practice, there are two main categories: dynamic, which is the active form of Qigong, and that focuses primarily on body movement, and especially movements that are the entire body or the limbs. Meditative or passive Qigong focuses much more on the breathing, and it's done in a position that can be maintained over time. So it could be standing, it could be sitting, it could be lying down, and it emphasizes breathing, and there's almost no movement involved. Now, with Qigong exercise, it is a simple exercise. The movements are very simple and can be done by most everyone, but there is actually a lot going on in our bodies. For starters, that slow, gentle movement. It's believed that that helps to warm up our tendons, ligaments, and muscles. It helps mobilize our joints, get those moving a little bit, as well as promote circulation of our body fluids, such as blood, the synovial fluid within our joints, as well as our lymphatic system. The second component to that, the deep breathing aspect that we focus on, plays a central part in helping to calm our sympathetic nervous system, which is our fight or flight. It also helps to activate our parasympathetic nervous system, which is our rest and digest side of the autonomic nervous system. That helps to regulate the involuntary aspects, such as breathing, heart rate, and digestion. So we're doing the physical aspect, we're doing the breathing. That breathing helps focus on, excuse me, tapping into that parasympathetic nervous system, which helps to reduce our stress, anxiety, and that sort of thing. And that actually has additional health benefits in addition to the physical. So risks and benefits. Based on research, empirical studies have been done using traditional Chinese medicine, using Qigong, and studying it in folks with different conditions. In most of those studies, it appears to be a safe form of exercise. Many of the studies indicate that there's no negative side effects to practicing Qigong, and that includes people with chronic diseases and for folks who are older. So not only is it safe, but it also can be helpful. A lot of research out there indicates that Qigong can be helpful for people with chronic problems such as fibromyalgia, chronic arthritis, COPD, Parkinson's, hypertension, CHF or congestive heart failure, and a whole host of others. It is also helpful for folks, older folks. Now, studies indicate that there is an improvement in quality of life. There are positive effects for people with depression. It can also help to improve our balance and function, which translates into improved fall prevention, which is a problem in our country with older folks and people with chronic health concerns. It also helps to improve symptoms of fatigue and has been shown to improve sleep quality. Talking about Qigong exercises, we're going to go through some of those today together. I'd like you to follow along with me. Remember that with any form of exercise, you need to listen to your body. Many of us have health concerns. Obviously, psoriatic arthritis is one chief among them, but those of us with joint problems, spine issues, chronic pain issues, we always need to listen to our body. We don't ever want to overdo. We don't want to overexert, push ourselves too hard. So if something is too much, you can always back down. All the exercises, excuse me, that we're going to do today can be done standing. If you need to, they can be done sitting. And the breathing exercises can also be done lying down. So those of us, if we're having some issues and we need to lay down, we can do the breathing and still get some of the benefits of the exercise. So remember, don't push too hard, listen to your body. If you need to sit and rest, sit and rest. If we have limitations within our bodies, we can always modify the movement so we can still get the most out of it without hurting ourselves. It's always easier to start simple, start low and progress from there. Okay. Now, these are some of the exercises that we'll be going over today. I'm going to go right down the line, starting with some simple breathing. Start off, I'm going to move into the screen so you can see. We'll start with Wu Qi breathing. Now, I'm going to do part of these standing and part of these sitting so you can see my body movement. Again, everything can be done sitting down. If you need to rest, or if you'd like to do them just sitting, that's perfectly fine. First one is Wu Qi breathing. We're going to put our hands over our abdomen and just relax. Spine is fairly tall, sinking in, and we're going to breathe in through the nose, filling up the abdomen and emptying out the abdomen with the exhale. So inhale and exhale. Nice and slow, and just relax your body with the breathing. Again, if you need to sit, you may certainly sit down to do this. For those of us who might have difficulty breathing, we don't have to go so deeply. Just breathe to the best of your ability. Inhale, fill the abdomen, exhale, empty the abdomen. Again, inhale, exhale. We'll do a few more repetitions of this. Nice and easy. Inhale, exhale. Inhale, and exhale. Okay. Now, the next form of the Wu Qi breathing exercise is just another variation. Same body posture, can be done standing or sitting. And you're going to hold your arms out like you're hugging a tree. Just hold there and relax. Let your shoulders relax. You don't need to raise your arms too high. Relax into this position and inhale. Fill the belly and exhale. Empty out. Again, inhale, exhale. Again, and exhale. Remember, if you start to feel tired, feel free to sit down. Occasionally, when we're starting to do some deep breathing exercises, sometimes people feel a little lightheaded. Be careful. You can always sit or even lean up against something. And exhale. Inhale. Exhale. A couple more times. And exhale. Very nice. Now, the next exercise is kind of a progression from that one. I'll sit down so you can see my arms. We're going to start with that Wu Qi, arms down in front of us. And we're going to go from Wu Qi to great circle. As we inhale, we're going to raise the arms up into a big circle. Exhale and let it down. So inhale, raising the arms. Exhale, letting it down. Now, you don't have to raise the arms super high, just as high as your body will tolerate. If you only go a little bit, that's fine. Just coordinating that movement with the breathing. It's going to help those joints get things loosened up. It's also going to help keep that circulation going with our breathing. Inhale, exhale. Now, those of us with shoulder problems, raising one side might be a challenge. You can do one arm, inhale to exhale, or you could limit the motion on the sore side. Inhale, exhale. Okay, so Wu Qi to great circle. Inhale, bring it up. Exhale, let it down. Just give a little angle here. Inhale, exhale. We'll do a few more. Exhale. Exhale. Relax those shoulders. Remember, we don't want to rise those shoulders up. Keep that spine upright the best you can. And again, you can always sit down if you need to. For our purposes, we're doing a few repetitions so everyone can see. If you can only do a couple, one or two, that's perfectly fine. You always do the best you can with what you got. It will get better over time. Next one, dragon claws. Now I'll stay seated so you can see my arms. I'm going to put one arm out to the side, and I'm going to turn my body toward that hand. I'm going to inhale. As I inhale to my belly, I'm going to draw that hand back, opening up my chest. So inhale, exhale. A little bit of a turn. Inhale, exhale. Again, if we have shoulder problems, there's no problem bringing it a little bit lower and working from here. Inhale, exhale. Inhale, exhale. Dragon claws, opening it up and out. A few more on this side, and then we'll switch to the other side. Inhale, exhale. Inhale, exhale. Couple more. Inhale and exhale. Open and close. And we'll go ahead and switch to the other side. Arm out, hand reaching toward it. Turn my torso toward my hand. Inhale to draw that hand back, opening up my chest. Big deep breath in, fill up the abdomen. Exhale, let it all out. Inhale, exhale. Inhale, exhale. Inhale, exhale. And again, you can lower if you need to, if you have shoulder issues or neck issues. Inhale, exhale. Inhale, exhale. Now, if we want to challenge ourselves a little bit, we can do it to both sides, alternating. We're getting into our standing position or sitting, stay if you want to. Arm out to one side. Inhale, draw the arm in. Exhale. And when my arm's down, go to the other side. Inhale, draw it back, open the chest. Exhale. Arms down, across. Inhale, exhale. Arms down, across. Inhale, exhale. You can always modify. Go lower, open, close, open, close. Remember to listen to your body. There should be no pain. If it's bothering you, you can modify the movement. Don't raise so high. Don't move so big. You can go to here and out, or if you need to modify and just work in this range. Modify it however your body needs to. A few more. Inhale, exhale. Other side. Inhale, exhale. And switch. Inhale, exhale. Inhale, exhale. Relax. Okay, next one. In case our shoulders are a little tired, this one's a good one to loosen up the upper body as well as our spine. Don't want to go too fast, but we're going to move a little bit quicker. It's called four hands knocking. So standing is easiest for you to see. Arms are down. I'm going to turn my body and just let my arms kind of wrap around my body. Not going too fast, but enough to let those arms just relax. This will take pressure off of our spine, take pressure off of our shoulders. Just let those arms swing freely. Not going super fast. We're not trying to twist ourselves off. Just want to move, let everything relax. If you've done some shoulder things, you might be a little tired. This one's a good one to relax. For this one, just breathe normal. Just breathe natural and just relax. Yeah. Those of us who are sitting, perfectly fine with your arms down by your side, and you can just turn the shoulders in your seat. And let those arms relax by your side and just breathe natural. Okay, so this is four hands knocking. Okay, again, everything can be done sitting or standing. Excuse me. Next one is called paint the wall. Again, sitting or standing is perfectly fine. We're going to stand. I'll show you some standing. Feet apart, hands down in front of our thighs. Now, as we inhale, again, through our nose, filling up our abdomen, we're going to bring the hands up. So just below shoulder high. Bring them toward us and let them sail back down. This particular movement is very common in many Tai Chi forms as well as Qigong. Inhale on the way up, hands in a little bit, exhale on the way down. Keeping that spine nice and tall, shoulders relaxed. Inhale, exhale. And just from a bit of an angle so you can see the motion. Inhale, bring the hands up toward us and down. We don't want any tension in our body. Everything is relaxed. We don't lock out our joints. We don't hold anything super tight. Everything is just calm. Get breathing going. Inhale, Exhale. Inhale. Exhale. Now, movements in Qigong, a lot of times, the way to key that, or way to think about it, is like if you're moving through water. Slow, relaxed, that natural resistance of the air against our body. So we're not going super fast, we're not a lot of tension in our body, everything is soft and relaxed. Smooth and easy. Inhale, exhale. Inhale, exhale. And again, if we need to limit our motion, that's perfectly fine. We can always work down here. Or if one arm is the best we can do, perfectly fine. Inhale, exhale. Or if we need to limit the motion on one side, that's perfectly fine as well. Best you can with what you got, and always listen to your body. Okay. Next one is Phoenix spreads wings. We'll put our hands out in front of us as we inhale, as breathing as we have been, in through the nose, filling the abdomen, out from the abdomen, emptying through the mouth. Hands out, inhale, open up the arms, fill up the belly, exhale, close them down. Open and close. Inhale, exhale. Now again, we can modify if we need to. We can open here and close. Open, close. And even if we have our shoulder arm issues, we can always just work with our shoulders. Open and close. Open and close. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Now again, when practicing this, you can do just a few repetitions. You can do it for a couple of minutes. You can do just breathing for a few minutes, whatever your body can tolerate, whatever you feel like doing for that day. Even if you do one or two movements just to get things going, it's a good way to start practicing. Now the next one, excuse me, swimming on land. We're going to put our hands like they're on a tabletop, and we're going to make circles. So draw the circle out, bring it toward the chest. Inhale, exhale. Inhale, exhale. And if you notice, I actually get a little bit of movement through my spine and through my shoulders. Inhale, exhale. Inhale, exhale. And again, we can always lower our hands down if necessary. Working low. We want to try and keep that tall spine, shoulders relaxed, and the breathing is a constant. Inhale, exhale. Inhale, exhale. Certainly never raise the arms up above shoulder high. You want to keep them low, protect those joints. Inhale. And then we can reverse the process, put the hands forward and bring the arms out. Exhale. Inhale as we bring it back. Exhale. Inhale. Exhale. Inhale. Nice and slow, nice and easy. And then we can lower if we need to. Okay, very good. Next one, gathering the chi. This one, be careful. You can do it sitting down, of course, or standing. You're gonna put your hands down, just down in front. Now, like you're raising up a big bucket of water. You're gonna pour it on yourself. Raising it up, inhale. Then you put your hands, push them down to the side. Now, it's really easy to kind of lean way too far with the back. You want to try to keep that spine nice and tall. Bring the hands up. Inhale. Okay. Make yourself a little taller, and then push down. When you're standing, inhale, exhale. Now you want to make sure you're not going too high with the arms. Right here is plenty. If it bothers the shoulders, smaller motion is fine. Inhale, exhale. Now when you're standing, you can add a little bit of leg work, a little bit of a sink into your feet with the movement. Coordinating. Inhale, elongate. Exhale, sink down into your feet a little bit. Again, inhale, exhale. Keep that spine nice and tall. Pick it up and down. Inhale, exhale. Now, for those of us who are sitting, same mechanics, tall spine, relaxed shoulders. Sometimes it's easier to perch yourself on the end of your seat, feet flat on the ground. And again, raising up, exhale, push it down. Inhale, bring it up. Exhale, push it down. And again, down. One more. Inhale and exhale. Now, the exercises that we've done so far, I like to use as a warm-up for my classes. So I'm going to have us go through each of those exercises. I'm going to do 3 repetitions of each. Traditionally, Tai Chi and Qigong exercises are practiced in multiples of 3. So we're going to do 3 repetitions of each exercise that we've done so far. Nice and slow, nice and relaxed. Remember, you can be doing it sitting or standing, whatever your body needs. Don't forget to modify the movements if you need to. If you're having limitations or you're having pain, certainly back off, back down, or skip that exercise. Just do the best you can with what you got. Obviously, like I said, listen to your body. So we'll start off again. In the Wu Chi breathing, hands over the belly, big deep breath. Inhale and exhale. Again, inhale, exhale. One more. Inhale, exhale. Now bring those arms out like we're hugging that tree. Inhale, exhale. Inhale, exhale. One more time. Inhale, exhale. Now we're going to go Wu Chi to great circle. Inhale, raise them up best you can. Exhale, sink them back down. And if you're standing, you can use your legs a little bit. Inhale, rising up. Exhale, sink it back down. So the whole body is working. Inhale, exhale. Next one, dragon claws. One arm off to the side, the other hand reaching toward it. Inhale, exhale. Switch to the other side. Inhale, exhale. Don't forget to limit your body if you need to. Inhale, exhale. Slow and steady breathing. Rotate through the hips, pushing through the legs. Inhale, exhale. One more each side. Inhale, exhale. Inhale, exhale. If you're tired and need to sit, feel free. Next one is 4 hands knocking. Just rotate the body, let those arms swing free. Breathe natural, go back and forth. This one will do 6 times. 4, 5, and 6. Okay. Paint the wall, hands in front of our thighs. Tall spine, shoulders relaxed. Don't forget the breathing to and from the abdomen. Inhale, bring the arms up. And exhale. Inhale. Exhale. One more time. Inhale. Exhale. On to Phoenix spreads wings. Arms out in front. Open. This one you can extend the spine a little bit. Exhale. Close. Down. Inhale. And exhale. One more. Inhale. And exhale. swimming on land. Draw it out, draw it back. Inhale, exhale. Inhale, exhale. And reverse the process, forward and around. Exhale, inhale. Exhale, inhale. Last one from the set, gathering the chi. Palms out forward, raise the arms up like you're bringing up a big bucket of water. Inhale, tall spine. Exhale, sink back down in toward the feet. Inhale, exhale. One more. Inhale, and exhale. Okay. Hope everyone's feeling okay so far. The next set of exercises is the 5 elements Qigong set. Now, in traditional Chinese medicine, there are 5 main elements: earth, metal, water, wood, and fire. And in traditional Chinese medicine, those elements coordinate with major organ systems in our bodies. And each of these exercises are intended to help issues in those areas. So the first one, we've already done it, is earth. Standing or sitting in our stance, sink into our feet a little bit. Again, tall spine, shoulders are relaxed, and put the hands over the belly. We've already done this one, is Wu Qi breathing, same concept. Inhale through the nose, fill up the abdomen, and exhale. Inhale, exhale. Inhale, exhale. Okay, we've already done that. This one again is one that can be done sitting, standing, or even lying down, just to focus on that abdominal breathing. The second one in the 5 elements set is for metal, and it works our lungs. Hands are going to be below face high and about head width apart. And as we inhale, we're going to expand our hands to about shoulder width apart. Exhale, and then back together. You can see from the side. Inhale, exhale. Spine stays nice and tall. You're sunk into your feet. Inhale, exhale. Inhale, exhale. Filling up that abdomen. Inhale, exhale. Inhale, exhale. A few more of those. Inhale, exhale. One more. Okay, the next one is water, and it's for our kidneys. We're going to go back to the Wu Qi position, hands on our abdomen. Now, for those of us who are standing, as we inhale, we're going to sink into our feet a little bit. Inhale and bend the knees as you're inhaling. Exhale and come back out of that. Those of us with knee or hip or lower body joint issues, be careful with this one. Small movement is perfectly fine. Inhale, sink in. Exhale, rise up. You're still filling the belly with the breathing. Inhale, sink in. Exhale, rise up. For those of us who are sitting, again, I like perched on the chair, feet flat on the ground, hands on the abdomen, and as you inhale, just kind of lower yourself onto your rear end. And then exhale, rise out. It's a small movement, but we're just sinking in and rising up. Okay. So from that Wu Qi position, inhale and sink in, exhale, rise up. Don't go too deep. Inhale, sink in, exhale, rise up. Inhale, sink in, exhale, rise up. Inhale, exhale. One more. Inhale, exhale. All right, the next one is wood, and that is for our liver. We're going to put our hands out in front of us, like we're holding a bowl. As we inhale, we're going to make a circle with our hands. Exhale, we lower down. Okay? Now, it doesn't have to be a huge motion. Make it as small as you need to, or as big as your body will tolerate. Come down. Still breathing in through the nose to fill the abdomen, emptying out from the abdomen from the mouth. And if you have shoulder issues or neck issues, we can always lower that bowl and make that circle down here. Inhale, exhale. Bring them up. Best you can with what you got. Inhale, exhale. Inhale, exhale. Tall spine, shoulders relaxed. Okay. Last one from the 5 element set is fire, and that's for our heart. Back to position here so you can see. You start with the left hand on top, right hand on the bottom, like you're holding a ball. Now, as you inhale and fill in the belly, you're going to separate those hands. Exhale, compress them. Inhale, exhale. Keep the spine tall, the shoulders relaxed. Inhale, exhale. Use only large enough motion that your body needs. Don't push too much. Inhale, exhale. Inhale, exhale. And then we can roll that ball and switch. So the other hand is on top, the other hand is on bottom, and work this side. Inhale, exhale. Inhale, exhale. Again, can be done sitting if you need to. Inhale, exhale. Inhale, exhale. Okay, just relax the shoulders. Now, with practicing these exercises, you can do one or all of them. You can do a couple repetitions, or you can start off standing, and then if you need to, if you start to get tired, you can go to sitting. Everything can be modified to our needs based on what medical problems we might have or physical abilities or limitations we might have. You can always limit the movement, limit the posture, take a rest, take a break, do just a minute or so, whatever your body needs. We're going to do the 5 element set now, start to finish, doing each of those exercises and doing repetitions of each. Now, we always go back to that first, the Wu Qi breathing, the earth posture between each of the exercises. So we'll start, I'll do it in standing. Again, remember, they can be done sitting. If you're getting tired, you can certainly just sit and rest and watch. Okay, so we'll start off in our posture, upright, nice and tall, hands over the belly. Tall spine, relaxed shoulders. 3 breaths here for earth. Inhale and exhale. Again. And exhale. And one more. Next is metal, or for our lung. Hands below, face high, head width apart. Inhale, open to shoulder width. Exhale, close. Open, close. Open, close. Okay, now we're going to go back to earth and breathe again. Inhale, exhale. Inhale, exhale. Once more. Next is water. That's where we go back to the Wu Qi position. As we inhale, we sink down into our feet. Inhale, exhale, rise up. Inhale, exhale. One more. Inhale, exhale. Relax, and then back to the Wu Qi position with the earth posture. Inhale, exhale. Inhale, exhale. One more time. Inhale, exhale. Okay. Next is wood. Hands up. Inhale, make that circle best you can. Exhale, sink in a little bit. Inhale, rise up. Exhale. One more. Okay. Back to the hands to the belly for earth. Inhale. Exhale. Inhale. Exhale. One more. Okay, and then fire. One hand on top, one on the bottom. Inhale and expand. Exhale and close. Open. Close. One more. Close. Roll the ball. Same on the other side. Open. Close. Open. Close. Once more. Close. Okay, hands back to the abdomen. Back to fire. I'm sorry, back to earth. Inhale. Exhale. Again. Exhale. Once more. Exhale. Okay, very nice work. Hope everybody's feeling okay. Hope they enjoyed that. Okay, that's the exercises for today. Wanted to talk about some resources just in case anybody was interested in pursuing Qigong practice. I listed websites and contact information for several organizations out there. So hopefully help you find an instructor in your area or someone who offers classes, especially for people with health concerns. Each of them, American Tai Chi and Qigong Association, the National Qigong Association, the Qigong Institute, those all list certified instructors. They also have more in-depth information about Qigong as a practice and the history behind it, the science behind it, and theory. I also put the Tai Chi for Health Institute. Dr. Paul Lam, he's a family physician who has adapted traditional Tai Chi and Qigong for specific health concerns, including arthritis, falls, rehabilitation, and the 5 elements Qigong set is from his training. So they also list instructors who are certified through that organization who are in their area. So all those are good resources for us if you are interested in pursuing and practicing Qigong. I also put my contact information and my website. All my contact information is there. If you have other questions or if you have questions for me personally, feel free to reach out if there are any questions.
Thank you, Craig. That was an amazing presentation of Qigong exercises that can easily be done at home. We'll now start our Q&A session. Our first question is, can people with mobility issues do these exercises successfully?
Yes. As I said, because these exercises are very low impact on the body, they do coordinate breathing and the movements are smaller and done slowly. So those of us with mobility problems can certainly do the exercises. And as I try to stress, everything that we do can be modified to our abilities. So we can always do them sitting down, we can do them holding on to something, or just limiting the motion of the movement to our capabilities. So anybody with a mobility issue can practice in some form.
And what can anybody do to prepare for exercise when you have chronic pain?
Okay, that's a good question. For those of us with chronic pain, it affects us head to toe, all of our joints, all of our muscles, everything's hurt. In my years in rehabilitation, in physical medicine, in martial arts, I have never found anything that is where exercise or movement is not indicated. It's just finding the right level for our needs. So certainly you want to consult your physician about any precautions they might have for you, any recommendations for you. Talk to an exercise specialist or a healthcare provider. But preparing, you want to make sure that you are in loose-fitting, comfortable clothing. You're in a safe surrounding in case there are fall risks. You want to, of course, listen to your body and always start small. Start simple and you can build from there. It's a lot easier to progress logically than it is to overdo, cause pain, cause problems, and then try to recover and get back to it. So small movements, starting simple, listening to input from healthcare professionals, and just gradually progressing yourself.
And will this exercise help improve balance?
Yes, there is a large body of evidence that traditional Chinese martial arts like Qigong help those of us with balance issues. And then also that translates and carries over into fear of falling as well as fall prevention. Because we do things in a weight-loaded position, we don't lock out our joints, we learn how to move with those small, subtle movements that actually helps improve our stability. It helps our core musculature, which is the heart of our stability with balance. So they do all help. Even if we do them sitting down, all that breathing and those small movements are engaging our core muscles, which will help translate into stabilizing our body to improve our balance.
Is Qigong similar to Tai Chi? We know Qigong is generally considered safe, only one main contradiction, which is a history of psychotic disorder.
Okay, yes, Tai Chi is similar to Qigong. Qigong is based in traditional Chinese medicine. Again, it's that form of exercise to circulate qi throughout the body. Tai Chi is a martial art based on the Qigong concept. So you can kind of think of Tai Chi as an advanced form of Qigong exercise because the principles of the breathing and the coordination of movement and all those things are present. Now, there is also a large body of evidence saying that Tai Chi is limiting risks and very helpful for those of us with chronic conditions and pain and balance disorders and that sort of thing. So they often, Tai Chi and Qigong get lumped together because they are so similar. Now, as far as contraindications, I have never heard of any contraindication for Qigong or Tai Chi practice. Again, with the right modification and limiting the practice. History of psychotic disorder, I've never heard that as a contraindication for Qigong. Again, because we are, with the deep breathing, we are tapping into that parasympathetic nervous system, which actually helps to reduce our stress and reduce our anxiety. So that would actually make it beneficial for folks with psychological or psychotic disorders. So I've never heard of that being a contraindication. I've never seen any research on that, but there is the body of evidence that shows that it's very actually helpful for mental health.
Thank you, Craig. What about if you're trying to find a Qigong teacher or class? What qualifications should you look for in the instructor?
That's a good question. There are, tons of martial arts schools. I own one. Finding, again, the resources that I listed there, they have what would I believe to be credible instructors. The Tai Chi for Health Institute, I have multiple credentials with Dr. Lam. The other sites all list certified instructors with years of experience. There is no governing body or anything like that, but that is a good place to start. My advice to anybody, including people who come into my studio, watch a class, try a class, interact with the instructor, kind of get a feel for them, see if there's a personality mix that works well, see what their belief is with people with medical concerns, with health issues that need to be addressed, and just try it out. Talk to the instructors, watch the class, like I said, or if they offer, try a class and see how you feel with that. If you feel a good connection with that instructor, or you feel like you are able to continue with that, do so. But again, the resources are a good place to start just to see if there are things in your area available, and that might be a good place for you to try pursuing it.
And where can someone find a kinesiotherapist such as yourself?
That's a little bit more of a challenge. Kinesiotherapy is a discipline of physical medicine and rehabilitation. Historically has been in the military, medical, and the Veterans Administration systems. So most KTs or kinesiotherapists are in like the VA setting. There are a few who are in the private sector. I was in the private sector for many, many years, obviously my facility. So finding a kinesiotherapist on the outside for the public might be a little bit of a challenge. My advice for those of us with health issues and in need of rehabilitation, things like that, talk to your healthcare provider, talk to a physical therapist, talk to an exercise specialist, and kind of follow that route for questions regarding your medical concerns or aches and pains and physical issues.
Will Qigong help with fighting fatigue?
Yes, because of the breathing exercises, because they're small movements, they're simple movements, non-stressful to the body for the most part, that actually, a little bit of exercise actually helps on a chemical level to improve our fatigue. So a little bit of getting things going is where we're getting that benefit. And again, the breathing helps us to relax, so we're not so stressed, so tense, and that also will help with the fatigue. Again, there's a body of research that shows that Qigong exercises are helpful for those of us who have fatigue or who have sleep disorders, which they often go hand in hand because of pain and that sort of thing. So it will help. It just, again, small amounts at a time, gradually building up.
Which exercises would be beneficial for bursitis or tendonitis in the ankle?
Okay. Because the exercises can be done sitting or standing, we're able to modify if we're having pain in the joints in the lower body. Anything where we're standing and we're doing like that kind of rising and lowering, like when we do gather, we kind of rise up and sink down. That small weight bearing through the ankle is going to help activate the joint, help circulation of the blood flow, as well as the lymphatic system and the synovial fluid, which is within our joints. So those small movements that we're doing, if you're able to do them in standing, is going to help that. That coupled with, just kind of pushing through the legs a little bit, activates the joint while stressing it. So that would be a good place to start.
Great, thank you. And have there been any research studies that Qigong helps relieve symptoms of psoriasis or psoriatic arthritis?
I have not found any research that has specifically targeted the benefits of Qigong for folks with psoriatic arthritis. Most of the research goes toward chronic issues, so it kind of gets lumped in there. I haven't seen anything specific to it, but for people with chronic pain issues, joint inflammation, that pain, all those things have shown benefit. Again, but I'm not aware of any specific studies that have been done for folks with psoriatic arthritis.
Thank you, Craig. We really appreciate your time and efforts to be here today. This was such useful information and will certainly benefit all our attendees and those who watch later.
Thank you for having me.
Thank you. Resources after our webinar today for upcoming events. Be sure to subscribe to receive notifications of any webinars or other events in your area. You can view this webinar along with past webinars in our watch and listen site at psoriasis.org/watch-and-listen. While there, listen to our podcast series, Sound Bites, to hear the latest episodes such as What Systemic Treatment Options Do I Have for My Psoriasis?, which launched today with Dr. Ahmad Shatil Amin from Northwestern Medicine Dermatology Department in Chicago. If you have any additional questions and are looking for tips to exercise safely, contact our Patient Navigation Center by phone or email as indicated on the screen. Thank you for attending today's webinar. Please take the evaluation survey via the link you receive after viewing today's webinar to provide feedback about the presentation and content. Tell us what you think. We value and appreciate your comments. This concludes our presentation. Thanks again for joining us for Qigong Simple Exercise for All webinar.